Hello, and today we are going to talk about the stress. Stress is something we experience every day, and it is inevitable part of our life, whether we are working, whether we are studying, whatever is happening in our life. If we see the definition, stress is the body's natural response to any demand or challenge. It can be a physical challenge, it can be an emotional challenge, or because of the surroundings, environmental challenge. Now, 77% approximately the people experience physical symptoms of stress. That's what studies show. 73% report psychological symptoms of stress, and 33% feel they are living with extreme stress. So, stress is acute stress, chronic stress, and episodic acute stress. Let's see what are the signs and symptoms of stress. So, in the physical symptoms, imagine the last time you were in the stressful situation. The first thing you notice is mera sar dukh raha hai. There is headache, or maybe heaviness in the head, or maybe shoulder pain in the shoulders. There can be some muscle tension, right? There can be some digestive issues, acidity, burping, a pain in the stomach. There can be, because of the stress, heaviness in the chest, and you feel that the heartbeat is getting faster. There is disturbed sleep. You either sleep very less, or some people sleep huge amount of time, maybe 9 hours, 10 hours, 12 hours, like that. So these are the physical symptoms. Now, what are the behavioral symptoms of stress? The person with acute or episodic stress or even chronic stress do not feel like to mix with people, avoids attending marriages or social functions, so they are emotionally withdrawn. Another behavioral symptom of the stress is changes in appetite. Either the person eats very less or too much amount of food. Procrastination. The person wants to do something, but the person is like postponing. कि कल देखते हैं, परसों देखते हैं, next month देखते हैं, अभी मुझे ठीक नहीं लग रहा है. When all are there, I'll do this. This kind of thing. Increased substance use. Maybe when there is stress, the cigarette smoking frequency gets increased, or if they are using alcohol or any other substances, that increases. Tobacco use increases. And neglecting responsibilities. In behavioral, the person is like feeling that, okay, I'm feeling very much overwhelmed because of so many things I'm doing, and the basic responsibilities, the person feels very heavy with them, overwhelmed with them, and person want to avoid responsibility. So we have seen the physical and behavioral symptoms of the stress, and now the emotional symptoms. You know very well, in the last time when you were stressed, you feel anxious, worried, right? Your mood is low, that I don't know, I'm feeling nervous whether this thing will happen or not, whether I'll be able to do it or not. If suppose a presentation you have to make in front of the class, or some assignment submission, you will see that there is irritability because you have to cross that deadline. There is anger, there is feeling overwhelmed. So this kind of emotional stress happens. Cognitive, forgetfulness, poor concentration, negative thinking, everything, whatever happens, the person automatic thought gets the negative only. Racing thoughts, poor judgment, these are the things happens because of the stress in the cognition, in the thinking level. Now, if we see the next slide, see stress response. Your brain and body under that stress and the pressure, what happens? The hypothalamo-pituitary axis is a central stress regulation system in the brain. Okay, so chronic activation leads to burnout, anxiety, and physical illness. So in the stress response, what happens? Some trigger happens. My boss shouted at me, or my teacher did not listen to me what I wanted to say. I was feeling that injustice is happening with me, and that is a trigger that teacher didn't understand what I want to say. Or parent is asking for some result and the child is not able to get the result, and the child is feeling stressed because of that. Parent is feeling stressed because of why this child is not able to perform. In office, in home, or at any other social place also, stress can happen and trigger can happen. Now, stress is a trigger is the perceived threat or challenge. What happens inside the brain? There is the area called amygdala. Okay, तो amygdala क्या करता है? ब्रेन में एक अलार्म जगाता है. ब्रेन्स अलार्म सिस्टम फायर्स, और वो क्या करता है? डेंजर वाला सिग्नल देता है कि ट्रिगर हो गया तो बस अलार्म बजा दिया, इट्स समथिंग रियली डेंजरस. और स्ट्रेस हार्मोन्स रिलीज हो जाते हैं क्योंकि बॉडी को अलर्ट मोड पे लाना होता है फॉर सेफ्टी. सो ऑल दीज इनसाइड मैकेनिज्म्स आर हैपनिंग फॉर सेफ्टी. कॉर्टिसोल और एड्रेनालिन रिलीज हो जाते हैं. फाइट एंड फ्लाइट एंड फ्रीज रिस्पॉन्सेस. सो बॉडी गोज इनटू द सर्वाइवल मोड. जो भी मुसीबत आई है उसको फाइट करेंगे. अगर हमसे ज्यादा लग रही है तो फिर हम फ्लाइट कर देंगे, वहां से चले जाएंगे, या तो फिर फ्रीज हो जाएंगे, दैट नाउ सरेंडर, दैट नथिंग इज हैपनिंग, एंड द माइंड फील्स ब्लैंक, body feels frozen. So these are the survival mode responses after the stress hormones released, right? So you either act, you flee, or shut down. How chronic stress affects your body? Now brain में क्या होता है? Anxiety, depression, memory loss, brain fog, these things happen when chronic stress is affecting the brain. डाइजेशन में क्या होएगा? इरिटेबल बाउल सिंड्रोम, इरिटेशन हो जाता है, लूज मोशंस होते हैं बहुत बार स्ट्रेस में. कुछ लोगों को एसिडिटी बढ़ जाती है, एपेटाइट चेंजेस, द पर्सन इज नॉट एबल टू डाइजेस्ट द फूड. There is nausea also. We have seen most of the time when you are nervous, there is interview or somebody you have to talk to, a presentation, there is nausea comes. So because of the very much stress, the body is responding in a different way, and digestive system get hyper vigilant. Heart, high blood pressure, risk of heart disease, and irregular heartbeat is the effect which is happening on the heart. On muscles, what happened? Muscle tension increases, chronic pain, headaches, and fatigue. Because of all that, stress is increasing. Immune system, weakened immunity, frequent illness, slow healing. That's what happens in the immune system because of the stress. And that is the reason in stress, we see that people, taking leaves, sick leaves a lot. They fall ill frequently, fall sick. The healing becomes slow and immunity is weakened. So the chance of getting viral infections or any other infections are high because immune system is entirely down. Hormones पे क्या होता है? Disrupted cortisol, और उसके वजह से फिर वेट गेन भी होता है स्ट्रेस में, और मेंस्ट्रुअल इश्यूज भी होते हैं, irregular menstrual cycles. Then PCOD is one of the reason because of the stress. तो हम इसमें क्या करेंगे? अगर स्ट्रेस होता है, आपकी बॉडी हेवी फील कर रही है, हार्ट बीट बढ़ गया है, if you are feeling very very restless, sleep is not there, then breathe and be present. That is the first step. That this step can save you from getting carried away into that down spiral of the stress, right? So this is the fastest path to calm down through your breath if you want to handle the stress. So there is a technique called 4-7-8 breathing, which activates your parasympathetic nervous system. So 4 counts you're going to inhale, 7 hold, and 8 count exhale through your mouth. Very effective breathing, especially to calm your parasympathetic nervous system in times of stress and in times of anxiety. Box breathing, used by Navy SEALs for stress control. And it is very very effective because you have to count, like 4 count breathe in, 4 count hold, 4 count exhale slowly through mouth, and 4 count again hold. Inhale, hold, exhale, hold. Inhale, hold, exhale, hold. Now you don't have to do so fast, you have to do it slowly. So inhale, hold, exhale, hold. And this is the box breathing. Very helpful before studies, for focus, and before doing the important decisions. Now, for being present and reducing stress, mindful is one of the very important strategy. What happens? It reduces cortisol by up to 20%. And best way to start mindful is just be aware the way you are breathing. आप इनहेल पूरी अच्छे से कर रहे हो जो आपके लंग के एंड तक आप फील कर सकते हो, एंड एक्सेल ऑल्सो यू आर डूइंग प्रॉपरली, जस्ट बीइंग अवेयर द वे यू आर ब्रीदिंग, वेदर यू आर डूइंग द एब्डोमिनल ब्रीदिंग कि आप जब सांस लेते हो तो एब्डोमेन बाहर जाता है और जब सांस छोड़ते हो तो एब्डोमेन अंदर जा रहा है. आप अपने पेट पे हाथ रख के यू कैन फाइंड आउट वेदर यू आर यू नो you are the abdomen is getting out when you are inhaling, and when you are exhaling, abdomen is going in. So that mindful kind of breath is going to help you. And when you are mindful about the breath, you can slowly shift that awareness, that mindfulness, into small little daily things. For example, you can shift that mindfulness when you are taking food. So see your food plate with a lot of mindful, being present there, and pay gratitude whoever has contributed in this food. I'm thankful to them. And then look at the food with love and what is there, and this much nutrition is going to be part of you. This chapati in the plate is going to be part of you again. This rice is going to be part of you again, and going to give you minerals and vitamins and strength and energy so that you can experience humanness in a better way. Such a beautiful process of eating food and having food in the plate. Be mindful, be present there, what is happening, how you are chewing the food. Be present and chew very slowly and in the present moment, not by while watching screen or TV. That is going to give you a different level of mindful experience. You don't have to go anywhere and do things. Whatever you are doing, do it more mindfully. That is going to really shift your stress level from high to medium and to be patient and do it slowly, and you will see the difference. Body scan is one of the very effective technique, that what is happening, because body keeps the score. So what is happening in the body, that body scan can help to reduce the stress. For example, you are carrying too much tension on the shoulders, so body can help to reduce the tension and stress on the shoulders or the thighs or in the abdomen. You have to first scan the body, notice where is tension, and allow yourself to reduce it. That is really going to help you. So practice this daily. Pick up one technique, practice daily for 5 minutes for 1 week, shift to another technique next week. This much is enough stuff to do every day. 5 minutes है, पर रोज करना इतना भी आसान नहीं है. I'm happy to say that here, while seeing follow-up in the clinic today, I saw that the girl is monitoring her stress level every day. I'll share the link in the description below, and you can start monitoring your mood, stress level, energy level. And I was so happy to see how was her mood in the whole week, and how was the stress level, and how was the sleep. It is easy for me to understand what is going on in the world, right? तो आप जब खुद होके करेंगे, how much difference you will see when you are tracking your sleep and your stress levels. Maybe it's not 100% perfect, but whatever you are remembering, when you are disciplining yourself to scan your day, that okay, which are the things which are draining my energy, which are the things which are adding me in energy, which are the things contributing to get me better sleep, which are the people in their presence I feel energetic, and which are the people in their presence I feel energy, like my energy is exhausted. This body scan is going to help you to aware that what is going on inside your body, and that scanning is also important, that data is also important, so that you can help yourself in a better way, that what is happening inside my body. And body carries a great wisdom. So don't forget to do each technique for 5 minutes, and the link I'm sharing below, you have to just show up there every day, click the link, fill up what and how you're feeling, and that's it. It's your tracking, it's your benefit, and nobody's going to check with you maybe, but you yourself is going to be honest with yourself. Now let's look at the 5 lifestyle pillars of stress relief. अभी स्ट्रेस रिलीफ के लिए अभी हमने एक बोला कि ऑडिटिंग, daily auditing also helps to relieve stress. I have witnessed today and I also do by myself, so it is really helpful. Second is move your body. 30 minutes of moderate exercise at least 5 days a week. Walking, yoga, swimming. This is very important. Exercise lowers the cortisol and releases the endorphins. Endorphins are the happy hormones. So exercise करके आप अपने आप के अंदर एक रासायनिक प्रक्रिया बना रहे हो which is going to help you to feel happy and nature's stress relievers, right? So move your body. Frequently stand up. If you have sitting job तो फिर आप बहाने बना के उठो, उठ के पानी ले लो, चलो, go till the door and come back. Just stand up, do simple stretching, maybe bending sideways and forward, backward, and then sit back. So moving is going to help you in blood circulation and releasing endorphins. और अगर moderate exercise करनी है तो वो तो करनी ही है 30 minutes के. Sleep is non-negotiable. 7 to 9 hours of night sleep is important, which should be sound. It's not like you're watching mobile and sleeping, watching TV and sleeping, because sleep peacefully. Create a meaning, create a ritual which is going to be calming. Next day, some small little planning, and with that, you sleep. So, create that wind down ritual. Blue light off 1 hour before bed. Poor sleep amplifies stress 3 times. So, if you really want to reduce the stress, sleep on time, no screen time before sleep. Nourish your nervous system. Reduce caffeine and sugar. Eat omega-3, magnesium-rich foods. Stay hydrated. Your gut produces 90% of serotonin. Connect with others. Social support is the number one buffer against stress. Weekly connection, say no to isolation and vulnerability is the strength. And number 5 is set boundaries. Learn to say no without guilt. Protect your time and energy. Boundaries are self-care, not selfishness. Psychological tools that work, evidence-based approaches, CBT, cognitive behavior therapy, cognitive restructuring of your thoughts, identify and challenge unhelpful thought patterns. अभी इसके लिए unhelpful thought patterns समझने के लिए हमें thoughts regular लिखने पड़ेंगे. आपको you have to actually make a diary and note down your thought. At least 10 minutes, do the free writing. You will write whatever comes to in your head. सिर्फ आपको प्रिकॉशन ये लेनी है कि आपको सोने से पहले वो नहीं करना है. यू कैन डू इन द इवनिंग, एज सुन एज यू वेक अप यू कैन डू इफ यू वांट, बट ये जो आप ऑटोमेटिक थॉट एक्सरसाइज कर रहे हो, ये पैटर्न्स आपको तब पता चलेंगे जब आपका रेगुलर होगा. सो एवरी डे keep 10 minutes, maybe around 4 to 6 p.m., which I usually recommend, and keep 10 minutes aside and write down whatever thoughts are in your head, and then see the pattern, what patterns you're carrying in the thought. Is it self-blaming or blaming others, or is it self-admiring, appreciating, gratitude? What is the pattern? Okay, and replace catastrophic thinking with realistic alternatives. Just अरे बाप रे, I can't take this if so much world war is going on and I really cannot take this. This is the catastrophizing thinking, that oh, something is happening in the world and you are thinking that okay, in my space nothing is going to work, but hardly that war is going to affect your personal life or at your home, right? So realistic alternative can be that okay, world war or some war is going on in the world, but right now I have something in my home to cook for. And if you don't have, then what alternative you can bring? Maybe you can bring induction cooker or something like that. So catastrophic thinking जो है ना, कि catastrophizing thing, that oh my god, उसको हम realistic में कैसे लेके आए, उसके लिए हमारा prefrontal cortex should be in place. And how that can come in the place? When the amygdala's alarms can stop. तो amygdala का alarm कैसे stop होगा? That something is danger and now amygdala is actually catastrophizing the brain. तो हम लोग क्या करेंगे? when you do the free writing, you are removing that alarm and urgency from the brain, so that emotional brain thoda sa shant hoke, cognitive brain, the prefrontal cortex actually come first, and the realistic and rational thinking can come, and take a place in the front. So identify and challenge unhelpful thought patterns by writing daily. Replace that very, very severe negative thinking into the realistic thinking. Now let's see what is the next tool. It is the somatic. Somatic में हम लोग करेंगे emotional freedom technique tapping. This also I have done with many patients and it really helps. So tap on acupressure points while voicing the stressor. Voice that you are releasing that. And rapidly, this again goes and calms the amygdala, limbic system, emotional brain, and regulates your nervous system and helps you to feel calm. Very instant effect, but whenever it happens, you have to do it again and again and again. Number 3 is reflective. Reflective journaling is one of the very important tool, psychological tool. Okay, it's an evidence-based tool. Expressive writing reduces stress hormones. 15 minutes of free writing clears the mental load. Isn't this amazing? Now, if you want to go into the depth, which, the therapist can do this inner work, so inner parts work. Listen to the stress part of yourself with curiosity instead of judgment. कि कहाँ से आ रहा है ये stress? Which part of me is feeling this much stress? What is happening in that space of me? Let me just be curious. Maybe you don't go into immediate fixing and releasing that part of you, but just be there. Acknowledge that part of you. Be kind to that part of you. Self-compassion reduces chronic stress. Now, next is somatic. Nature and grounding. 20 minutes in nature. It can be a garden, greenery, you're walking around in nature, or maybe a riverside, on the beach, anything. 20 minutes in nature lowers cortisol significantly. The 5-4-3-2-1 grounding technique anchors you in the present. I'll create another video, 5-4-3-2-1 grounding and other grounding techniques. You can search, or maybe I'll post a link in the description and watch that video to learn these techniques in detail. Here we are learning that this is the somatic technique and this is going to help you for grounding. Behavioral. In behavioral, your boundaries helps you to manage your time. Time management and stress management, I think they are from the same family. So prioritize using some measurement matrix. Break tasks into small steps. Done list, to-do list, something separately. Whatever you feel like, you can basically keep a track of how much time is going in what thing and how much important that thing for you, and then how can you change it. So this tracking is important, and that's how you're going to set the time. When to seek professional help. Now, knowing when to reach out is a sign of strength. It is not a weakness. So stress interfere with daily work. अगर ऐसा हो रहा है कि रोज का काम ही नहीं हो पा रहा है, relationships are getting affected or basic functioning, take help. Persistent anxiety, panic attacks, or inability to relax, take help. Using alcohol, substances, or harmful behaviors to cope, take help. Persistent low mood. कितने दिन से वही लो मूड, अच्छा नहीं लग रहा है, उदास लग रहा है, किसी चीज में मन नहीं लग रहा है, social circles have reduced, the person has stopped playing guitar or singing or any hobby, hopeless लग रहा है, or thoughts of self-harm. I don't want to live this life anymore. Then immediately professional help seeking would help. Physical symptoms with no clear medical cause. Feeling like no coping strategy is working, then take professional help. So professional help Options can be psychiatrist. Psychiatrist is a doctor who has after MBBS in India. They have done their specialization, either diploma in psychological medicine or MD degree, uh, and they can prescribe medicine. Some of the psychiatrists also do counseling, but counseling also can be done by a clinical counselor. She teaches the coping mechanisms with certain things, and you feel that there is some way, there is some hope, there is some help. Therapist is a deeper work again, because they actually find the root cause and help you to resolve that, heal the inner wounds, past trauma, childhood trauma, and that's how different professional things are there. You can decide what you want and go accordingly, or if you go to counselor or psychologist or therapist, they can also guide you that okay, you need medicines, then they can guide to doctor, psychiatrist, and if they think that okay, counseling and therapy will work in this case, you can proceed that way also. Or it can happen in a way that psychiatrist you go to fix the problems with the medicines, and then the psychiatrist can send you if further help is needed to counselor or therapist. That can also happen. So, or otherwise go to your family doctor, tell about all these things, and then the doctor can guide you where to go. Your daily stress toolkit. In the morning, in during the day and evening. In the morning, 5-minute deep breathing or meditation. No phone for first 30 minutes. Eat a grounding breakfast. Set 3 intentions for the day. That these are my intentions, and this is what I'm going to do with this intention. Have this intention bigger than you, which is aligned with your values. Cold water face wash or shower can help you in the morning. Now, during the day, 90 minutes focused work blocks. Pomodoro technique you can use here, where you are setting up the alarm for, maybe suppose we are saying 90 minutes, but don't start with 90. I recommend first start with 20, then 30, 45, 1 hour, and then 90. So when you are blocking that time slot and then working, what happens that you know that alarm is going to ring after the time is finished. So you feel like doing that work with 100% concentration. 2-minute breathing breaks hourly. Walk outside at lunch. Say no to one unnecessary thing. Unnecessary hai, no bol do, right? And hydrate every hour. इवनिंग में क्या कर सकते हो? 30-minute wind down routine. Journal 3 things you are grateful for. No screen 60 minutes before bed. Light stretching or yoga. Review and release the day. That is the evening routine. So, what are the key takeaways? Remember these 5 principles. Stress is normal, chronic stress is dangerous. Know the difference. Number 2, your breath is the fastest tool. Use it intentionally every day. Lifestyle, medicine, okay, sleep, movement, nutrition directly regulates the stress. So sleep properly, move your body, nutrition, omega-3, magnesium, use these things with nutritionist help if possible, and lifestyle is medicine. Number 4, psychological tools work. CBT, EFT, IFS, and journaling have strong evidence. Seeking help is wisdom. Psychiatrists or therapists can transform your life. You deserve a calmer life. Start with one small step today. Subscribe for weekly mental health tips. Comment your bigger stressor below or biggest stressor below. Share with someone who needs this. I'm Dr. Vrushali. See you in the next video. Thank you so much.